My left side of my body was paralyzed, and I had some cognitive issues where I wouldn't complete sentences, and I sometimes talk about random things, tell people to go home when they came to visit me, things like that. The primary reason for me not staying in the hospital was it being a hospital, and I wanted to get out of the hospital as soon as I could. I don't like hospitals. From the first moment you enter the facility at CareMeridian, you know you're not in a hospital. You're in a home environment, and that is really key to recovery and giving you a positive outlook on your recovery. It doesn't feel like a hospital room. It feels more like a home atmosphere, like a room you would have for your own, where you could decorate it as you might wish, bring things from home. They encourage you to bring photographs and hang them on the wall. Day to day, you've just recovered from a stroke or whatever it might be, a brain injury, and you might have an off day or a really good day. And the therapists, they kind of chime into that, and they realize that some days you're not feeling good. So they might just leave you alone for the morning and then come back in the afternoon and say, okay, it's time to work now. But they're always there, and you know they're going to come by during the day, and not to bother you, just ask you, do you want to work now? And they kind of leave it up to you. There is that motivation there, but they do have a feeling for the individuals. I really felt that. The relationships I've made when I was at CareMeridian were actually vital in my recovery. The enthusiasm that people have is very critical, and they help you to want to recover. And I never wanted to stay in bed because my therapist, it was almost like I was letting them down if I wanted to stay in bed. So I felt I needed to prove to them that I could do it also. I just want to tell people who are in my situation that that's a nice place to go. And I want them to have the same experience I did.